As we approach the end of the year, millions of Americans who rely on Medicare are running out of time to choose their coverage for 2025. The Medicare annual enrollment period ends on December 7th, so now is the time for them to make that crucial decision about their health care. So joining us to discuss this is the president of Medicare at United Healthcare, Bobby Hunter. Thank you so much for joining us. I know this is such an important topic, especially this time of year. So the annual enrollment obviously is going to be ending soon. So why is it such an important time for individuals on Medicare?
Yeah, well, thanks for having me. Yes, choosing the right Medicare plan can be one of the most important decisions a person makes, not only for their health, but also for their wallet. And like you said, we're currently in the middle of the annual enrollment period for Medicare, which started on October 15th and runs through December 7th. And this period gives people the chance to confirm their coverage or make changes for next year, which can be really important if there have been changes to your current plan, changes to your health status, or to your budget, and lead to some unintended consequences if you don't take action during this critical period.
And do you have any advice then for people like when they're choosing their plan? Because I know there's so many options.
Yeah, and I'll start by acknowledging that choosing a Medicare plan can feel complicated, but it doesn't need to be. I would say first take inventory of your health needs and how those have changed, and then review what changes may be occurring with your current coverage to make sure those needs and coverage still align. Second, determine if your current plan is still the best fit for your budget. And that means paying attention to more than just the monthly premium. Make sure to also review other potential out-of-pocket costs like deductibles and copays, because those can add up as well. And that's actually why a majority of Medicare consumers now actually choose Medicare Advantage, because of the choice, affordability, and predictability it offers. And that can show up as low or $0 premiums, $0 preventive care, and an all-in-one coverage option for prescription drugs, which makes the whole process and experience much simpler.
And we know cost is a huge factor, right, for a lot of people. But what are some of the other aspects we should consider when enrolling in a Medicare plan?
Yeah, well, one of the most important will be confirming that your preferred doctors and hospitals are still available through whatever plan you're considering. For example, in 2025, United Healthcare will again offer Medicare Advantage's largest national provider network. And what that means is anywhere you are in the country, members will pay in-network costs when seeing any of our more than 1 million care providers. Second, don't forget about all the extra benefits you can get through your plan. Many people are often surprised to learn that original Medicare doesn't cover most dental, vision, and hearing services. However, many Medicare Advantage plans do. So make sure to review those options. And maybe lastly, make sure that your medications are still covered. Even if you don't expect to make a plan change, this is a really important step to make sure that your regularly used prescriptions will still be covered as part of your plan next year.
Wonderful. Well, thank you so much for joining us. Where can we go, though, if we need a little bit more information?
Yeah, a lot of great resources available. For more educational information, you can visit gettoknowmedicare.com. And for more about United Healthcare plans, you can visit uhcmedicarehealthplans.com.
All right. Thank you again. And a reminder, everyone, you have until December 7th, and you know it's going to be here just like that. And if you'd like to see this interview again, everyone, just head to First Coast News Plus.